Physical assessment skill. The purpose of this skill is to demonstrate performing a complete and thorough assessment on an adult patient. The recommended PPE for this skill are gloves and eye protection. The first step in this skill is when you approach the patient, assess their appearance and their work of breathing, and then assess their level of consciousness. I'll introduce myself if they're alert. Sir, my name's Nathan. I'm a paramedic. Can you tell me your name?
My name is John.
So I'm assessing the patient's speech and their mood, as well as their orientation to person, place, and time. John, can you tell me where you're at today?
I'm at home.
And can you tell me the date?
Today is the 22nd of March.
So I've assessed that the patient is fully alert. I'll have additional questions to assess the patient's memory. Next, I'll assess the patient's vital signs, beginning with blood pressure. Next, I'll assess the patient's pulse, both radial and carotid if necessary. I'll assess the patient's respirations, the rate and quality of respirations, ensuring the patient has an adequate tidal volume, meaning they're breathing in and out adequate volumes of air. I would assess the patient's temperature and apply an SpO2 monitor to the patient. Next, I'll do a further assessment of the patient's skin, checking the color, temperature, and any moisture. I'll then perform a detailed head-to-toe assessment, assessing for deformities, contusions, abrasions, punctures, penetrations, burns, tenderness, lacerations, or swelling. Beginning with the head, I'll assess the skull, check the nose and ears for any drainage, assess the pupils for size and reactivity to light. I'll then assess the neck, check the position of the trachea, check the condition of the jugular veins. I'll then assess the chest, observing chest wall expansion, palpating for integrity, noting any open wounds. Sir, do you have any pain when breathing?
No.
I'll then assess the patient's lower airway by auscultating the lungs. I'll then assess the heart and blood vessels, again palpating a radial and carotid pulse if necessary. And then I'm going to auscultate heart tones. I'll then assess the abdomen, looking for any open wounds and palpating in all four quadrants. Assessing for rigidity or tenderness, any distension. Next, I'll roll the patient on their side to assess the back, using additional help if necessary. Assessing for any deformities, open wounds, or masses. Go ahead and roll back. Then assess the stability of the pelvis. I'd expose the patient, and if indicated, assess the genitalia. For male genitalia, assess for wounds, rashes, external lesions, or drainage. For females, assess for wounds, rashes, external lesions, or drainage, and ask about any bleeding. Then assess the lower extremities. Check motor, sensory, and circulatory functions. Going to locate an arterial pulse, so I'll palpate a pedal pulse. Ask the patient if they can move their foot. Can you feel this?
Yes.
Assess the other extremity. Palpating a pedal pulse. Sir, can you move your foot? Can you feel this?
Yes.
Assess the upper extremities. Palpating a radial pulse. Sir, can you move your hand? Can you feel this?
Yes.
And check the other extremity. Palpating a radial pulse. Can you move your hand? Can you feel this?
Yes.
After completing the head-to-toe assessment, we will then continue with patient care.
This video will show you how to assist with a complete physical examination. Equipment and supplies will vary depending on the type and purpose of the examination and personal preference of the medical provider. Here you will see many different types of medical supplies that may or may not be used during a physical examination that you are assisting with. For example, a Snellen chart, scale, stethoscope, blood pressure cuff, ophthalmoscope, otoscope, thermometer. Before interacting with the patient, perform hand hygiene. Greet and identify the patient and explain to the patient that the provider will be performing a physical examination. The patient should have an empty bladder. If a urine specimen is needed for the examination, provide the patient with a urine specimen container. If a urine specimen is not required, simply offer the patient the opportunity to use the restroom. Please make sure that the patient knows how to find the restroom. During this interaction, you will want to obtain the patient's vital signs and measurements, including temperature, pulse, respiration, and blood pressure, including the height and weight. Immediately document this information. Provide the patient with a gown and give them instructions on disrobing. Explain to the patient whether the opening of the gown should be in the front or the back. Excuse yourself from the room to provide patient privacy while the patient disrobes. Knock on the door and identify yourself and ask permission to enter the room. Once inside, place the drape over the patient's legs and inquire if they have any questions or concerns. Inform the provider that the patient is ready to be seen, and you will assist the provider as needed by handing them instruments and other supplies needed during the examination. When the examination is complete, perform hand hygiene and assist the patient to sit up slowly. Assist the patient off the examination table. Ask the patient if they need any help getting dressed. If not, leave the room and allow the patient to get dressed in privacy. Once the patient is dressed, provide the patient with any further instructions and go ahead and show them how to check out of the office. After they leave, clean the examination table and the room and prepare it for the next patient. Resupply any supplies that are needed, including replacing soiled linens. Properly document any findings and procedures into the patient's medical record.